As for Dr. Brené Brown, 87 emotions and experiences makes us human. If you would like to learn more about human emotions, please read the book Atlas of the Heart by Dr. Brené Brown. Hi, my name is Dr. Kritika Mehra and welcome to the Art of Patient Communication. Today we will be talking about vulnerability. Before we dive into the how and what of communication, I would like you to understand that communication works inside out. If you have watched the movie Inside Out 1 and 2, you will know exactly what I mean. What comes out of our mouth, how we react, what we say is dictated by which emotion is in control at the console in your brain. So emotions could be joy, sadness, anger, fear, anxiety, embarrassment, envy, and ennui. The point that I'm trying to make is that in early days of our clinical journey, when we have just graduated from our universities, we know all the textbook knowledge really well. And when we go in the clinical day-to-day scenario, the unfortunate situation is that a lot of scenarios don't go by the textbook. As a dentist, I can explain you what happened in my career or what I see. That, for example, I see a clinical scenario in a patient where they have a decay or a hole in one of the teeth. And I look at it and I think, yep, I can exactly envision how the end product is going to look like. But unfortunately, most of us, including myself, I forget that that tooth is actually connected to a human who we can't control. And there could be scenarios like, a patient has a very strong gag reflex, patient has a very strong tongue, or patient has high fear and anxiety coming to the dentist. And that actually dictates the end product, which may not be textbook perfect. When scenarios like these happen, that they make us feel sad. And unfortunately, we don't talk about them enough, or we don't go out there and ask for help enough. In my clinical career, I have seen so many young graduates, including myself, where we are too embarrassed or we have the fear of getting embarrassed, so we don't ask for help. We think that they will judge our work and just don't take help, which is what is actually hindering our progress. Now, that could be happening because we either don't feel that we are in the safe environment, or, as I said, we have the fear of asking for help. And what happens is that in these scenarios, we start fearing those procedures, and the anxiety related to those procedures start to go higher and higher. And at the end, we just succumb to our circumstances and we just say, you know what, I'm not going to do that procedure. And somewhere in our soul, we feel incompetent, which is not good for our confidence. It is extremely important for us to become aware of our emotional well-being or of the emotions that we are going through at a certain point in time. We should be in check with what's actually happening and go and seek help. And I define this as being vulnerable or vulnerability, where you decide to shake hands with your inexperienced self or yourself that actually needs help. And if you shake hands with your vulnerable self, you can actually go and speak to your friends, to your partner, to your colleagues, or even to your mentors at work. Because when you open yourself up about what you are not good at to these people, you will connect with them a lot better at a lot deeper level. In other words, you may even connect with yourself a lot better. You will start to understand where you are, because vulnerability leads to connection, and in the long run, it leads to competence as well. Because when you open yourself up and say, I don't know this, or I'm not good at this, or I need to work on this, somebody, who are your well wishers around you, they may say, oh, why don't you do this? And then you can go and learn about it or read about it, and that will make you a better version of yourself. So vulnerability goes a long way. Let me tell you my story. Over the last 10, 13 years of my business ownership, I have come across lots of pairs of owners. So one of the pair is very good at clinical skills, and the second half is very good at administrative skills. But at the same time, they both are clinicians. And I am one of that pair. So me and my husband, we own our dental practice, and Jimmy, my husband, he is extremely good at the clinical skills. And I was a very administrative clinician. So I worked on the operations, on the backbone of the business, while he could pursue his clinical journey. Somewhere along the journey, I started to come across some behaviors from my support team where I realized that the clinician, my husband, was given more value, more importance in my own business because he is the one, or he's been the one perceived as bringing the most revenue in. There would be little things that would happen for me to feel that way, or little comments here and there. For example, there was a day, I used to have administrative days where I would be doing my administrative jobs or operational jobs or working with the managers to make sure that the business is going to run smoothly the next week or the next month or the next quarter. And one of my team members just walked in my office and said to me, "Oh, Kritika, there is an emergency patient. Since you're not working today, would you like to see that patient?" Which kind of makes you feel and stop and reflect and think, am I not working today? Am I not adding value in the business? And those administrative days were actually very, very heavy days for me. And those comments, they have left a very deep scar on my soul, because when my underconfidence kicks in, they are the things that come straight in front of me, that I'm not competent, I'm not the one bringing the revenue in. And I struggled with these facts or these things that were said to me for years, and I bagged myself out over and over again and brought my confidence down. And it even affected my clinical ability of even trying and going ahead with complex procedures, because I would just tell this to myself that, oh, I'm not the clinician to do this. And I was well aware of what I was doing, and I started comparing myself with Jimmy, even without knowing that I was doing it. I knew that it is not the right thing to do. I shouldn't be comparing, but that's where I was. And then obviously he is my business partner, he is my husband, and it does tends to affect your personal life as well. When it got to my home, I thought, now it's the time to take help. And that's when I went and saw a therapist, and I brought all my emotions out of what I was feeling, why I was feeling. And as we unpacked all these emotions, it was clear that comparison was something that was affecting my competence as well. And my therapist actually said to me that, Kritika, comparison destroys individuality, and we must embrace our own abilities. I think ever since I have accepted that fact, and I know that how good I am at administrative skills. Jimmy can't do that. and I think I'm happy with it. And look, these demons, they come up over and over again, especially when you are feeling low with whatever reason you are, because it is life. It's not constant. It is going to go up and down. But the thing is that by saying it out loud, I've actually worked on it, and I feel content and happy with it. The message of today's podcast is all of this is work in progress, and you are perfect the way you are. Thank you for listening, and hope you got something out of it. Follow me on Instagram, and don't forget to subscribe to my channel on YouTube. See you.